my name is Georgia Roark. I'm a 4th semester nursing student. Today is March 28th, 2019, and it is 11:30 in the morning, and I'm going to be doing a female catheterization. So beforehand, I want to make sure I have an order from the doctor to place the catheter and what size, so I have a 14 French. And then I'm going to assess my patient's condition, last time she voided, and the amount, and also if she has any allergies, especially to latex or betadine. So let's get started. Hi, Mrs. Jones. My name is Georgia. I'm going to be your nursing student today. How are you doing? Good. Can you tell me your name and date of birth? Perfect. And do you have any allergies? No? Good. I'm going to go ahead and raise her bed up to a good working height for me, so up to my waist. I'm also going to lay her down in the supine position and provide for privacy. Okay, so now I'm going to go ahead and get my patient, expose my patient. Mrs. Jones, I'm going to expose you now. Okay. And I have a bath blanket along with me to provide for some privacy. I'm going to go ahead and put her legs in the frog leg position. Go ahead and lower this bottom part of the bed a little bit. Okay. Mrs. Jones, are you doing okay? Good. I'm going to go ahead and put on my clean gloves. Go ahead and clean. So we're using 3 wipes. So first I'm going to do the outer labia, pinch, the inner labia, pinch, and then meatus. And then I'm going to dispose of these gloves. Hand hygiene. Now I'm ready to set up get my sterile kit ready. Okay, so I'm going to make sure with my gloves and my sterile field that it hasn't been tampered with, and check the expiration date, and of course check for latex allergies, but she does not. So go ahead and get this ready. Okay, now I'm going to go ahead and get my sterile gloves on. I'm going to glove my dominant hand first, and then my non-dominant hand. Okay, so now I'm sterile, so I'm going to go ahead and get my field set up and ready. The shiny side down. I'm going to protect my hands. Okay, and I'm just going to drop it because I don't want to become unsterile. I don't need this. I'm going to go ahead and pitch it. And I'm going to go ahead and get my stuff ready. So I'm going to open my swab sticks. Go ahead and lubricate my catheter For female, lubricate 2 inches. So I'm gonna go ahead and do that. Okay. And then I'm gonna go ahead and also get my syringe hooked up. Depending on policy, your hospital may ask you to inflate the balloon ahead of time. Mine does not, so we're good. Inflate it to check and see if it works. Okay, so I'm gonna go ahead and clean. So my left hand is now unsterile. So I'm gonna go ahead and do the outer labia. Inner labia. And the meatus. Okay, so now I'm ready to go ahead and insert my catheter. So for a female, you go 3 to 4 inches. And I'm gonna ask my patient to take some deep breaths and bear down, like she's going to the bathroom. Mrs. Jones, I'm gonna go ahead and insert it now. Okay, so you wanna go 3 to 4 inches. When I see urine, I'm gonna go 2 more inches. And then I'm going to go ahead and grab with my non-sterile hand an inch away and go ahead and inflate my balloon. Depending on the order of how much to inflate it, it's usually 5 to 10 milliliters. Okay, and then I'm tugging for resistance, perfect. So I'm gonna just take this off and get rid of this. So I can go ahead and, I no longer have to be sterile since it's in. So I'm gonna go ahead and remove my gloves. Perform hand hygiene. And then I'm gonna go ahead and put on some clean gloves. Mrs. Jones, how are you doing? Are you doing okay? Good. Okay, so I'm gonna go ahead and get this out of my way. And I wanna go ahead and I wanna make sure it's attached for female in the inner thigh. Making sure that it's not tugging, enough room for some slack. And I'm gonna go ahead and put my catheter bag on a non-movable part of the bed. And you wanna check to see how much urine output comes out. Some hospitals only allow a certain amount at a time to be released, so sometimes it's only about 750, I believe. So put that. And you're going to take this sticker, and I'm going to label it with my the date, the time, my initials, and the type of catheter, and I would stick that on there. So let me go ahead and switch all this side, and I'm going to go ahead and clean one more time, just to get all that betadine off. Do the same thing I would do all the other times. The outer labia. Okay, I need both of them. All 3 of them, how about that? Inner labia. And then kind of just around the catheter on the meatus. Okay, so I'm gonna go ahead and clean up my field here. I would dispose of it. And then I would make sure my patient is comfortable. Cover it back up. And I would go in and document, or go out after I get my patient all situated, and I would document the date, the time, the catheterization, what size it was, how my patient tolerated it, and the type of urine I saw and the amount. I would perform hand hygiene before going and doing all my documentation. So now I'm going to go ahead and I have a doctor's order. It's a few days later, and it is time to remove it. So I'm going to go ahead and come in and explain the procedure to my patient again, what we're doing, and check the name and date of birth again, and for allergies, just in case. Raise it up to my working height. I'm going to expose her again. Mrs. Jones, I'm going to expose you. Probably still bring a bath blanket in with me this time as well, just to provide for that extra privacy. And then I'm going to go ahead and put on some gloves. I have two here. You want to make sure you have a syringe to deflate the balloon. And I bring a towel with me. Bring a towel to lay under her, because there will probably be some urine come out when I take the catheter out. I'm going to put her back in that frog leg position. And this towel under here. Okay. Now I'm going to go ahead and my syringe. I'm going to let her know what I'm doing. So Mrs. Jones, I'm going to go ahead and deflate the catheter, okay? So obviously you'd want to check to see how much was inflated, because that's how much you're going to deflate. So mine was 10 milliliters, so I'm going to deflate 10 milliliters here. Mrs. Jones, are you still doing okay? Good. Make sure the curtain is pulled for privacy again when I came in, obviously, but it was still closed because we're just combining the video. Slowly but surely, we're deflating that balloon to 10 milliliters. Awesome. So I'm going to go ahead, pull that out. And I want to make sure that my balloon is intact still, so that is good. I'm going to make sure I am checking the urine to see what kind of urine output there was. And I would dispose of this properly. However, the hospital protocol called for. For now, I'm just going to throw in the trash to get out of my way. And I'm going to go ahead and clean my patient up. Again, the outer labia. Inner labia. And I would want to let my patient know that there probably will be some burning feeling the first time she goes to the bathroom. And then I would go ahead and get my patient back in a comfortable position. Dispose of these and the dirty linens. Cover her back up. Perform hand hygiene. And then I would go ahead and make sure her call light is near, put the bed back down, and I would go out and document the taking out of the catheterization, how I did it, how my patient tolerated the time, the date, and the amount and color of the urine that I saw when taking the catheter out.